Now I'm going to show you where exactly you have to hit. I mean, this thing is killing me right now. This morning when I woke up, I was thinking hip replacement again. This happens at least twice a year. Oh, right there, dude. Oh man, that is murderous. That hurts big time. Oh man. Now here's the hip, my hip right here. And this morning when I woke up, I mean, it was unbelievable pain. You know, I was thinking every couple of times a year, I'll tell you. And it goes all the way down to right here. I mean, I can feel it right here. Right there. Ah, man. It's like this whole area right here is inflamed. All the way up. Yeah, I think it's right here on this cut muscle. Right there. You see, I don't know if you can see that cut muscle, but right there. And I'm telling you, dude, that right there is, oh man, that is killer. And actually I can feel it all the way around here. All the way around here, all the way up to my hip, and back down again this way. And right there, right over my knee, all of this stuff is all connected to your hip. Oh man, right there, dude. I mean, that is killer. And I'll show you another way to address this. Oh, enough. I'll show you. Okay, now this is the other way to address this hip pain. You gotta I got this big ball here, and I'm putting it right on the affected area. And this is murderous. You gotta roll that sucker back and forth. Man, this is killing me. Oh God. This is unbelievable. But this is the only way to get rid of this pain. I mean, right now it is really, really hurting bad. But by tomorrow, the pain will have diminished quite a bit. I'm pretty sure, because I've been working on this all day long. You want to bring this guy up underneath your leg and roll it back and forth. Right there. That's another area of contention. Right there, right underneath this. Actually, that's just about where that acupressure point is. That has given me so much trouble, right inside the cut of the muscle. But this is all related to my hip pain. I can absolutely guarantee you. But in 2 or 3 days, I'll be able to do this, and there shouldn't be any pain at all, really. Okay, and another way you want to do this is to address the actual hip area, and that's by putting your hip right on top of the ball and just rolling it back and forth there. Oh man, that feels good. It hurts, but it still feels good. And you want to run up and down that hip, up and down the hip, and you want to put some weight on it. Right there. I don't know if I'm getting a good view because I can't see the video screen, but this is just about the only way that I know to get rid of hip pain. By tomorrow, I shouldn't be having, well, maybe 2 or 3 days, because this was pretty bad this morning. But this always works. This happens to me at least once or twice a year, maybe more often than that. I wake up, usually when I'm sleeping on my side, I wake up and it feels like, as soon as I wake up, it feels like, you think hip pain. We're talking a hip operation here. I think that's why all these people go and get hip replacements, because of this little bit of inflammation I say it's a little bit. It is actually a hell of a lot of information. But this inflammation, if you address it correctly, now I'm working right over right over my knee. I don't know if you can really see it. Not over my knee, but right on the side of my knee. And this, oh man, this is killer. Right there. Okay, so I found two places that are really affecting me here. It's right here on the left side of my, right on the side of my knee here, and right here on the side, right inside this cut muscle. You work those two areas, and on the hip, using a hard. This is a hard, very hard ball here. I don't know if you can see it, but it's a very hard medicine ball. Weighs about 10 pounds. And this is really, really effective if you have hip pain, back pain, upper back pain. This is a fantastic weapon to attack all of those situations. This is how I attack my back pain. And you also want to work your gluteus maximus. Okay, you got to work your butt muscles because all of this stuff is connected. You have a whole trio of muscles inside your butt there that really, really control your back pain, your leg pain, hip pain, all of those areas. If you get those muscles get a lot of tension in them, I think that's probably pretty much what causes all of these situations. But for this morning, it's just been this left hip here. Oh man, right there, dude. That is killer. Especially when you toss it over to the side a little bit. It's excruciating. But in 2 days, 3 days tops, this is going to be history. And I always use my acupuncture ball to work on this problem. You move it up a little bit. Here, it's starting to get a lot better already. I mean, before I could hit on this space and it really hurt. That still hurts right there, right on the back of that cut muscle, right inside that cut. That's still hurting pretty good. But I'll tell you what, in 2 or 3 days, I'll be able to hit on this guy. Oh man, it's all the way up, all the way up. This is the only way I know to get rid of hip pain, and this works every time, every single time. And we're looking at day 3 here, rather day 2. Thanks for watching. And I'll tell you what, I'm pretty much over this. I think can't seem to find anything that's really hurting right now. That right there is still a little tender. Right there. Okay, I found it again. I don't know if you can see where the heck it's at, but it's right here. Where you... Right there. It's right where the fat part starts. I don't know if it's the fat part or not, but let's see if I can move in a little bit. Right there. Right there. Yeah. That hurts. Right there. You can see the cut of my muscle right here. And it's right inside that cut, right there. See if we can get a better jump on it here. Oh, I'm missing it. It's right there. Yeah, that hurts. Okay, let's see if I can do put a little pressure on that guy. And right on the side of my knee right here. you can see that right there. But all in all, I think my hip problem, well, my hip hasn't been hurting since yesterday after my first procedure. Now, and that's when I found all of this pain down here in this muscle, right here on the side of my leg and underneath it, kind of right in the cut. But getting rid of, I'll tell you what, working on all of this area here, all the way up to the hip. Here's the hip, all the way, from here to here. It's that big swath right there. You just work that guy, and that'll take care of your hip problem. Of course, like I said, you also have to work right here where your butt meets the top of your leg. That is always an area of contention, just to keep it loose. You want to keep that area loose. And if you do this kind of exercise, I don't know, every 2 or 3 days, you shouldn't have any problems. And this gets rid of hip problems like there's no tomorrow. You don't need a hip replacement operation. You wake up one morning and you think, oh man, my leg is coming off. It ain't. Okay? That's all you got to do is work those acupressure points, and you'll solve this problem right there. That's where you'll solve that problem right there. That hurts. That hurts big time. But this is gonna. I'll tell you what. I'm gonna do another one tomorrow, and I will put all 3 of these together and stick them up on the internet. I guess maybe tomorrow, depending on how bad this problem, how well I've resolved this problem. It's starting to get a lot better right now. I can feel it getting a lot better. I mean, it's just about gone now. Any kind of pain that I was having there when I was doing this to it, even doing this. I mean, as far as just walking around and everything, I don't feel any kind of pain at all anymore. But whenever I'm putting pressure on it like this, it's definitely painful. But it's a good pain, okay? This is the kind of pain you want to have so that you won't have the other. This gets rid of any kind of inflammation problems you may have in your hip. And if you use this method, you'll never have, well, I can't say you'll never have problems again, because I wake up with this, I don't know, 3, maybe 4 times a year, depending on how hard I sleep. It looks like whenever I sleep hard, I always sleep on my side. Whenever I sleep hard and I wake up the next morning, it's the leg that's on top that is the one that's giving me the hip problem. But this solves it. Good thing. I don't know if this is just because I play tennis and I've been playing for, I don't know, 30 years or something, but that may be a cause of it. I don't know. I think a lot of people wake up with hip pain and they think hip replacement. I mean, because it's that excruciating. It is an unbelievable amount of pain. You feel like your leg is coming off. Okay, enough. And I'll record tomorrow and I'll let you know what happened. This is a lot better. See ya.